migraines, brain fog, low sex drive, low energy, even bone loss, memory loss, even. When we tell our doctors this, when we go in, or even if we complain to our friends about it, or family members, when we're in midlife, a lot of times we're told that we either need to tough it up, it's just age, accept it, or we're told to go on things like antidepressants or synthetic birth control pills. Well, today I want to dive a little bit more into this, a lot more into it actually, talking about hormones, specifically testosterone, and a lot of other questions I want to ask her today. I've got Dr. Kelly Casperson here today, and I really want to talk with her about this because she is a fascinating MD. If you at all are on Instagram, you've probably seen her there. She's got some great informative videos, but as she just shared with me before I pressed record, it's really hard to get things across in a minute or a minute 30 seconds. So we are going to dive into all the topics today. Thank you so much for being here. Thank you, doctor, for jumping on today.
Thanks for having me.
So I'm going to just dive right in because I have so many questions, and I'm going to start a little bit more basic, but let's talk about the hormone testosterone and why people associate that with being a male hormone specifically.
Yeah, one of my most favorite topics. So testosterone is made by the ovaries. It's made by female adrenal glands, and we make testosterone in a lot of end organs. So brain makes testosterone, lots of other body parts, right? But a good 25% is coming from ovaries. What does an ovary do with testosterone? Makes estrogen. Right. I didn't get taught that in medical school. I got taught women make estrogen, men make testosterone. And it goes back to this gender bias stemming from, well, first of all, we like to keep things simple, even though things aren't simple, right? But when they're discovering rooster testicles make testosterone and cow ovaries make estrogen, and they were really kind of looking in that basic thinking of like, what makes the man, what makes the woman, the woman? Let's keep it super binary and super black and white. And so now 100 and some years have gone by. Google still gets it wrong. Google says testosterone is the male hormone. The Harvard website gets it wrong, says testosterone is the male hormone. That's not true. Women have 4 times the amount of testosterone in their bodies than estrogen. Men just have 10 to 20 times that of women.
Wow.
So to say it's the male hormone is very wrong. And I'll flip that. Men have estrogen. In fact, men have so much estrogen, they have more estrogen in their bodies than a postmenopausal woman does.
Really?
Yes.
I had
it's
no
very
idea.
very important for their sex drive. Fascinating studies they did to figure that out. But estrogen's important for a man's sex drive and bones.
Wow. But they don't say to a man, your sex drive is lower. Here's some estrogen. They say, here's some Viagra, or they say they do other things. Why is that?
We simplify things. Again, physicians aren't taught about hormones. Physicians certainly aren't taught about sex, right? So everything I know, I did my own learning because a patient changed my life in clinic. So
Wow.
I was a practicing urologist for 7 years. Woman came into my clinic crying about her sex life. And that was the perfect time for lightning to strike my brain to be like, I don't know. I was told women were complicated and we'll never figure them out. And don't worry, the gynecologists are taking care of them anyways. Keep in mind, I'm a urologist. I do all the Viagra and the testosterone in men, right?
Totally.
So I was like, is it true? Is it true that women are complicated? And so I went into this deep dive about female sex med, realized gynecologists are already busy. They're not taking care of female sexuality, and started learning a lot, enough to have a podcast, write a book. And then the hormones started happening because people are like, well, you know what happens with menopause and your sex life? And I'm like, no, I don't. And I'm staring down the barrel at it too. And so then I started getting into hormones of like, why don't we learn about hormones? Why are we so scared about hormones? What's this WHI study that's freaked everybody out, right? And so I joke and say I got into hormones because of sex.
I love that journey though, because that brings me to another question. So many women, they're saying that they're not happy with their sex drive. And a big thing that comes up is that all of a sudden their man, their husband, their spouse is working on their sex drive. They're like, wait, this isn't my normal. They go to the doctor, they get a Viagra, whatever it is. And now we're not addressing the woman's problem.
That's
so
right.
now the husband has a deeper sex drive. The woman has a lower sex drive, and they're told it's their problem, their fault, or accept it.
That's exactly right. And I'm very glad you're bringing this up because it's a bunch of bullshit. So we have studies that when a man, anybody really, a woman could do this too, right? But when a man goes in and he gets his sex drive treated or his testosterone treated, and then he goes back saying, I'm ready to go, you've destabilized the relationship.
Yeah.
And in my experience, because I have the great fortune of treating men with Viagra and testosterone, now that I know as much as I know, I wasn't this good before, I say, what's your plan with this super dick?
I love that question. I would love to be a fly on the wall with those answers,
Right.
but
I
that's a
know. I
great
mean,
question.
I've done a lot of study to be able to be as bold as I am. But so I use, I was like maybe 50%, maybe guys have a plan, right?
Yeah.
Like they know what the plan is, right? I'm telling you, 9 out of 10 do not have a plan.
So they're just saying something's changed. Help me with this. And they're not thinking this through.
I'm like, do you have a partner? Do you have multiple partners? Are you like,
Yeah.
let me know how to have this conversation. Oh, okay. You have a
Yeah.
wife. Okay, good. So does your wife, is she interested
Yeah.
in having more? Have you talked to her? What's her plan? And if she's perimenopausal, postmenopausal, breastfeeding, anything that can affect sex drive, being treated for cancer, whatever it is somebody taking care of her?
Yeah. Oh, I
Because
love
if
that you're
you,
asking that. Yes.
yes, because if you go home with a super dick and you put this all on her that now she needs to, metaphorically rise to the occasion, that's not cool and it's not going to go well.
No.
So now, more and more urologists are realizing like, because the thought was like, there's just a guy in my office, I'm going to help the guy.
Yeah.
But you're like,
Yes.
if you truly want to help him be successful sexually, that usually involves a partner, and you need to have that conversation as well. So more and more, it's still very rare, but more and more people are treating couples for
Yes.
hormones and sexual dysfunction. That's something I do in my
Wow.
clinic. That's something that some of my friends do because it's freaking brilliant.
It's brilliant. It is absolutely brilliant. And I've not heard of this happening, and it definitely needs to happen. It's not a separate thing. It needs to be together. This is absolutely brilliant. And I love that you're asking that question because you're right. This could destroy a marriage. This could really, if we're really off there.
Yeah, I have friends who are divorce lawyers,
Oh
right?
gosh.
Yeah,
Yeah.
And there's one friend, and like you want her on your side, if ever
Yeah.
in that room, right? And she's like, speaking of gray divorces, right? So kids are out of the house, career's going well or is winding down, whatever. Older divorces, she's like, the gross majority, if not all, are because of untreated menopause. And this is not to blame the woman. This is just saying we are not addressing some basic needs that could help intimacy and people stay connected as the years go on.
No, I was definitely misinformed here. I feel like I'm a little bit more knowledgeable when it comes to perimenopause and menopause because of my questions and my podcast and how I've been curious and learned and with myself. But what I was not aware of was the idea of adding testosterone at an optimal dose or a higher dose to help fix that. My brain went right to estrogen and doing that first and then progesterone. And it wasn't until I added testosterone in that so many things elevated that I wasn't even aware were missing. Like I know
What'd you notice?
Like I noticed all of a sudden way more clear thinking. I noticed definitely higher sex drive for sure. I definitely noticed more energy, like no slump in that afternoon. And then the other really weird thing I noticed was I started having like all these memories, like vivid memories of things. And then I was like, and I just connected that recently that is probably a testosterone benefit too.
Brain. Totally. I mean, it's fascinating in my practice with testosterone. Like the accepted, we'll say that the accepted, the most studied is for low libido. And then people will say you can't say you can't say it helps with mood. And I'm like, what's a libido?
Yeah.
And they're like, libido's a mood. And I'm like, okay, so it helps with mood and it also helps with other moods because it's a brain neurochemical. So women will say,
and that's why people say I'm not in the mood. I mean, that's what literally the word.
It's a freaking mood. Like I'm like, point to your body where libido happens, right? It's your brain. So, women will say like, I can think faster. I'm more curious about the world. I'm asking more questions.
Yeah.
I feel like myself again, which is a huge one. These are things that are ultimately very difficult to study in a lab. How do you study? I feel more like myself. But I would argue that is the most important thing to give a woman is her sense of, I feel like myself again. One woman said, that part in The Wizard of Oz where it goes from black and white to technicolor? That's my brain on testosterone, the technicolor.
It's so interesting in midlife. Like the more I learn, the more I unlearn, and that there's just so many different things, but I don't believe that there's just one, like it's just this or it's just that. It's like this whole idea of being a health detective. But why is testosterone specifically seem so hard to get from doctors? Like you go in and unless you say I have low libido, low sex drive, it seems like they don't want to prescribe it.
That's right. So multiple things. Number one, the gender bias of testosterone's for men, estrogen's for women. Number two, there's no big pharmaceutical push. We have no FDA approved female product. That will be changing. But currently we have no FDA approved product, which means it's a bigger hurdle. You have to figure out how to dose a male product. You have to go compound a product, or you've got to go spend more money on pellets, right? So you're pushed to the fringes because we don't have something that's easy to dose and is covered by insurance. And then number three, it's a whole laundry list. Number three, doctors aren't trained in sex med. So even if you can get it for libido, nobody really wants to talk about libido. And number four, like the studies really are for libido. And we haven't, because if the FDA tells you I'm going to approve this someday for libido, guess what you're going to study it for? Libido. So we have a lot less studies on bone health, cognition. But listen, humans are humans, and the data on men is profound. You know, we know that men with low testosterone have higher rates of dementia. So
men with lower testosterone,
men with low T have a much higher rate, statistically higher rate of dementia. And so to me, I'm like, we know how it works on mitochondria. We know how it works when protecting nerves. We know how it works.
Sure.
It's just, think of a study that would have to happen to prove testosterone helps dementia in women. That's going to be a 30-year study on a generic medication, right? Like it's never going to happen. So for people to be like, you can only use it for libido, is like, well, not technically. Like the hardliners say like that's what we have the most data for. But are you going to wait around 40 years for
No.
You're not going to do it. You're going to be like, it helps my brain. I tried it. It's incredibly safe. That's the thing. It's a hormone your body naturally makes. Can we even call that a drug at some point? We're just giving you back what you made more of when you were younger, and now you don't make that.
It's replenishment, not even replacement to me. It's replenishment. You know what's interesting is believe me, I'm surrounded by midlife women in my communities, my friend, everywhere. That's who I'm with. And what seems to happen so many times is women start to justify, I'm just not interested in sex anymore. It's just not important. And they literally, like, they lose their sex drive and they start justifying and accepting and thinking that they're the normal. This is normal. I shouldn't have a sex drive. Something wrong with my husband, or something's wrong with this. And I want women to understand that when you actually get that back, you will not feel like that ever again, because it's such an important part of our life. And it's not a shameful thing. Like you should enjoy sex. You should want it. You should have a sex drive like that. It's actually the opposite. It's a bigger problem to not have it, I feel.
Yeah, I mean, a lot of people feel that way. My view is I'm never here to tell a woman she has to have sex or she needs to enjoy. Like, I'm like, if you're happy, you do you, right? Like, I don't care. But to me, I'm like, a lot of people, and this is where, sex is complicated. Sex is biopsychosocial. It's not just estrogen. It's not just testosterone. Of like, if she was having shitty sex in the first place for decades and now she wants to give shitty sex up, like, I don't blame her.
Yeah, that makes sense.
And so it's like, if a woman who's having a great sex life, if that stopped on Tuesday, she would be like, oh my God, like life's not as great, but if a woman's like, dude, I was doing this for somebody else. It kind of hurt all the time. I never had an orgasm. And frankly, I'm happy to give this thing up. I don't know what you think is so wonderful about this. Do you blame her? Right.
No, but that makes me sad too, because I feel like she hasn't had proper hormones or whatever it is. Like she hasn't been optimized. And so she doesn't even know what maybe
she had bad sex when she was 28 and her hormones were perfect. Right.
Totally.
Like many more women are having less orgasms, less good sex, unaddressed pain with sex. Like sex is bad regardless of your hormone status.
Okay.
And so to me, I'm like, and that's where women get, I had a woman the other day, she's like, I've been on testosterone for a year and I still don't have libido. It's like, testosterone's not a light switch. It's a hormone.
No. Yeah.
Right. And sex is so many things. It's your relationship, your body image, your ability to focus and be in your body, communication with your partner, like prioritizing orgasm equality. So to me, I'm like, honey, don't think testosterone's going to do it for you all the time.
No. So it's looking at the whole picture and what else is going on there and healing from that, I would imagine. And I hear what you're saying. If it's just not of interest and that's fine and they're happy with that, then you don't need to fix it, I guess, if it's just not of interest to you.
I think that you got in a relationship that was sexual. Somebody wants to stay sexual. Somebody doesn't want to stay sexual. That's fraught. Like, how's that going to play out?
Right.
Right. And so for somebody to be like, hey, maybe I do want to learn more about how I can be interested in sex. That is a great journey worth having. And, why I started my podcast and wrote my book is like, we didn't get good sex ed. You got a disease and pregnancy prevention plan if you were lucky.
It's true.
Right. And so really, like, as an adult, especially with changing hormones, being like, maybe I never learned about this stuff in the first place. and using it as a
Good point.
personal opportunity growth to be like, oh my God, sex can be for me. What a novel idea to learn at 47.
Yeah. Wow. What about people that want to increase their testosterone? They're wanting to do this. They think this might be a thing.
Mm-hmm.
Can they do it naturally, like without doing hormone replacement? And what does that look like? And then I'm going to talk about hormone replacement with you.
A lot easier, and we don't have great studies, but a lot easier for men to do this because their factories, they don't outlive their factories in most cases. Meaning a lot of lifestyle issues can impact testosterone in men.
Okay.
Stress, sleep, alcohol, exercise, diet. Those are the 5 pillars of healthy testosterone in men. And sometimes they still need help supplementing, right? Shift workers, people who aren't sleeping, super bad. Your testosterone is made while you sleep. So sleep's super important. But for women, we now outlive our ovaries by a significant number of years, right? And that's interesting to get into. But for that, like, you can't yoga your way into ovarian function, right?
Yeah.
And so when people kind of start throwing this word natural around, which I think is really a wonderful word to oppress women, they start being like, outliving your hormones is natural. And it's like, no, honey.
Yeah. I agree.
Dying in childbirth at 24 is natural.
Ooh.
Right? Like, we're so good at not dying by natural causes now that we're actually living a very long time as a society, longer than we've ever lived before. So I get very irked when people are like, low hormones is natural. It's like, no, death at 51 is natural.
You're right. What about supplements, like things like, or DHEA, like supplementing with that? I know that's still a hormone, but when people talk about like natural supplements or like taking something to increase your natural testosterone, is that a thing? Does that work?
How is DHEA any more natural than testosterone? Just because one's a prescription and one's not? Why is that the dividing line of what natural is?
Makes total sense.
I will pick apart the natural argument 7 times every single day to make people think.
Wow.
Of like, oh, you think because something's a supplement, it's more natural than something that's a prescription? That's completely arbitrary. DHEA is a prescription in Canada and testosterone's over the counter in Mexico.
Wow.
So don't tell me that that's the dividing line of what natural is.
Oh, I love this. This is so brilliant. Okay. I never heard it this way, but this is incredible. I need to know this because this is what, and there's a lot of people selling supplements that are supposed to do that, but you're right. That makes sense. So where's the dividing line? What about
Where's the dividing line? Yeah. So to answer your question, DHEA is an over-the-counter supplement in America. Probably works better in perimenopausal because you still have ovaries that are functioning a little bit, right? DHEA has to convert into testosterone and other metabolites. So the data is stronger in perimenopause than postmenopause. It's still, I'll use the word fringy for lack of a better word. Like, we don't really know who exactly DHEA is for, but it's pretty darn safe. If you're going to do it, just start low.
Yeah. It makes sense.
It's
not going to hurt anything.
It's not going to hurt you.
Yeah.
At lower doses. Take higher doses and.
When it comes to testosterone replacement, there seems to be a lot of different forms. Like some people do under the tongue, they do a troche, they do an injection, they do a pellet. What does all of that mean? And is there a preferred method?
Yeah. So everybody's doing everything because we don't have one standardized FDA approved dose for women, right? So we have to make stuff up at this point. So a troche is basically a dissolvable, a sublingual, or you put it in your cheek. It's basically transdermal, but not through skin.
Okay.
It's like not dermal. Mucosal is the right word I'm looking for. Compounded. Insurance doesn't cover compounded things. Remember this. Pellets are a little incision near the buttock, longer lasting, so nicer plug and play, but pellets tend to be the most expensive and pellets tend to be the highest dose.
And it's a little mini surgery, right? Because you're having to have your doctor put it in.
It's a teeny. It's teeny. But you're planning on living 40 years post-menopause, right? Do you want 40 times 4 a year incisions in your butt?
Got it. Yeah.
Right. And plus, you might have to remortgage your house for that much cost of testosterone. So that's what I see in women who drop off the pellets. They're like, I didn't really want to keep getting that procedure and it's really expensive. So women will do pellets because their friends did pellets, and like some people will feel really freaking good on pellets because it's a big steroid dose. And then you kind of chase that high because you don't get the steroid high as much anymore. So very classically, a woman's like, I felt amazing.
Yeah.
And then I didn't feel that amazing again the other time. Right.
Okay.
And then,
so it's like that first boost of it. You're like, wow. And then
it's amazing. Yeah. And then you tell all of your friends how amazing pellets are. And then they all get pellets. And then you all stop doing pellets. And that's like how it works. Transdermal, just a cream. You can get compounded, super cheap. I get mine for like $60 for 3 months supply, once daily dosing, nice steady state, really hard to go too high on that.
Sure.
You can also use a male gel like male FDA approved gel. Again, insurance still argues like
Yep.
if you're trans or if you're male, it's covered. But if you're a woman, then it's not.
Right.
May I remind you that trans and many men use testosterone off label. So the argument that it's off label is not a way to be covered, again, doesn't hold up.
Sure.
Because other people are using it off label and they get theirs paid for. Women, there's a huge bias against women. So some people get injections. They just like doing once a week.
I do
doses.
injection.
Yep. Some
I
people
do
like injections. So you'll find some experts who think there's one best way because that's the way they do it.
Mm-hmm.
But I'm more like a restaurant menu of like, listen,
That makes sense.
I got 6 different ways to cook chicken.
Yeah.
Like,
So
some
you just talk
people,
about the pros and cons to each
Yeah.
of them to with your patients, and they decide. How do we? So it's interesting when I share that I'm on HRT because I am on all 3.
Mhm.
People will say, well, "What's your dose?" And what I always answer is, "It's not my dose doesn't matter. It's our blood work, and then it's custom for us."
It's how you
is
feel.
that accurate? First
Yes.
and foremost, and then can we talk about ideal ranges like on blood work and how accurate is blood testing?
Horrible, but better than saliva and urine.
Okay.
So,
Yeah, let's talk about that because a lot of people recommend Dutch test
Yeah.
let's
Well, if you
help.
want to empty your wallet and spend a shit ton of money, go get Dutch tests 4 times a year. Like, be my guest. I'm not getting rich off of it. But like, this is how I think. The average person, how long do you want to live with hormone supplementation? 40 years.
Yes.
Okay, let's not spend thousands and thousands of dollars all the time to do that. I always say, spend your money on your expert. Don't spend it on bullshit.
That's brilliant.
Like, have a great doctor in your pocket. That's who's going to talk you through all of this and hold your hand way more than like, you need to pee for $400 to do a Dutch test. So Dutch test people will say it's the best. It is not supported in mainstream science as being very helpful, and it's the most expensive way.
So the reason they say that, and I'm totally open-minded here, is their whole thing, what I've heard at least, because I've definitely had many doctors tell me to do a Dutch test.
Mhm.
What they say is your blood serum is kind of like a one indicator, and then your Dutch test, or some people say saliva, tells you how you metabolize it. What does that even mean?
Exactly. Who cares?
So it doesn't matter. Okay.
Here's the thing. We have so little science and data on hormones that people are grasping at what they can to try to be scientific and do it right. They might be right, but I am a big skeptic. I mean, I'm an MD, PhD at heart. So it's like, yeah, maybe they're right. But until they have the data to back it up, that metabolism frickin' matters. And why would you metabolize hormones differently now than when you were 32?
Yeah.
Like, question them.
Okay.
Right?
So
question, why does it matter?
It makes sense. It makes sense. So,
and it might matter, but we don't have the data on it to like legitimately say it matters yet.
So
I like to be a little bit cynical because it's your money.
I get what you're saying. You're not saying like it's terrible, don't do it. You're saying we don't know enough, so why do you need to do it? Because it's not. Yeah. You're saying it's not. So you're like, you can if you want. It's just not. It's like this possible. Maybe it works, but we don't really know.
And the thing is, most people do perfectly well on cheap, generic, bioidentical hormones with a couple of blood work tests, and that's all they need.
Yes. So what I've heard you say before, and I didn't ask you about this here yet, but when I've heard you say you want to really go off how you feel. So more on how you feel versus just labs. But if we look at the lab, I'm assuming still look at labs. Is there like I know it's not completely accurate all of the time. I get that. But like, for me, I love my labs for me, and I'm not a doctor, but I really know my labs, and I like getting them every 3 months because I love, for me, maybe I just geek out over it, correlating how I feel with what it says. And then it helps me understand where I want to be range wise with things. So do you do that at all with the labs, or what even numbers are important there?
Everybody gets a baseline, and then everybody will get follow-up, especially with testosterone, to see,
Okay.
are you absorbing it? Are you absorbing it? Are you really, are you a high absorber? And what I mean by that is a transdermal product, right? Like if you're injecting or getting a pellet, like it's in your body. So to check on the labs and to do that. But remember, like, I will be a cynic, Natalie, like,
yes,
your labs aren't accurate all the time. And if you check them Monday and Tuesday, you're going to get 2 different values.
Totally.
And if you're just looking at that to feel good about yourself, like, good, it makes you feel great.
Yeah.
But labs are not gold. Like, scientists know that. And even testosterone labs, right? If I check it today, was it 4 hours after I got a dose, or was it 6 hours after I got a dose?
I feel the same way about my bank account. Like, it could say something's not there, and I'm like, no, it is there. I feel like it's there. So let's apply the same to our, I'm going to
Dude,
apply
I
that.
am stealing that analogy. That is so good. But yeah, so it's like when we put too much weight on things, we just need to check ourselves with that sometimes.
It makes sense. Okay. So that being said, I heard what you said there. If labs were accurate, like if we knew that they were accurate, is there kind of like and I'm going to tell you specifically why I'm asking. Is there a range? Like I'll tell you for me personally, I was on cream testosterone for years and it did nothing for me. And my labs always showed I was super low testosterone. Didn't matter how many times they applied it, didn't do anything.
Yep.
So I switched to injection and I feel phenomenal on it. But now I'm told it's a little too high on the labs. So I'm trying to understand, somebody else listening might feel this way too. Like, I heard you say on another podcast I listened to, you said kind of ideal spot if looking at a lab is like 70 to 80 for a woman. Is that still what you think?
Yeah.
Or okay.
Yeah, so labs, and we'll use the two most common ones in America is LabCorp and Quest, because those are the ones that I've actually researched what their testosterone lab values are. First of all, you have to get the mass spectrometry lab. You can't get the male testosterone lab. Do not check that if you're a woman.
Got
because
it.
it is grossly inaccurate in values under 100.
Okay.
So don't waste your money. It can't measure your testosterone. It's going to make up a number, right? Going back to like, can labs be trusted?
Yes.
Right? So mass spec is the lab. The lab for Quest, it'll say male, female, child testosterone. That's usually the mass spec one. So make sure you're actually getting the proper lab. Now, every lab has a range, right?
Mm-hmm.
Quest, I believe off the top of my head, goes down to 2 as normal. So lots of women, they'll be like, I got my testosterone checked and my doctor said it was normal. Well, I know that 2 is not normal.
No.
Right? That's just what the lab
Very
is
low.
choosing to make. Now, a lot of the low libido studies, when they found improvement in libido, it's actually slightly supra-physiologic. What does that mean?
Mm-hmm.
Let's say if 40 is physiologic to you, then a woman's going to start feeling better with low libido at around 60 or 80, right? Not crazy super-physiologic. When we start talking 250, 300, those are low male values.
Got it.
You're going to start possibly getting some androgenic side effects if you use that long term, right? So then I tell women, hey, how do you feel? She comes back, she's 60, she's 60, let's say her lab's 60. She's like, oh my God, I love it. I'm so happy. And I'm like, okay, now you need to know your lab is flagged as high. It has a red flag on it. It's flagging it as high. But for you, that's where you feel good, right? So normal is not always optimal. Somebody said optimal is a setting on your washing machine, not what your health should be. So the point is, yes, above physiologic is where a lot of the data is for libido.
Okay.
Experts know that. They know it. How do you feel? Are you having acne? Are you feeling anger? Are you losing any hair? Watch out for things as if you push it higher. Now, some women thrive at higher doses.
Which is me, I think, because I have none of those symptoms and mine is definitely higher.
And it's something to watch. And this is what I mean, again, you know me now. I'm pretty cautious on all of this. And so to me, I'm like, androgenic side effects can develop slowly over time.
Yeah. So when I heard you say that, I already decided I'm backing off because I don't need to be as high. Like mine spiked, like went from nothing to like, whoa, like really high. My body's just like, yes, thank you. So I'm based on that. I don't want to be that high. Like
for years.
Yeah. I want to be.
We just look at trans data. You start a woman on 10 times the testosterone dose. Does she look like a man immediately? No, it takes a while.
Yeah.
Right. And so I
have no interest in looking like a man or growing facial hair or any of that. So
so I feel like I'm very like, some women do better at higher values. Some women have naturally higher testosterone, but I just caution, like, hey, if you like riding high, and for our discussion, maybe we should not say what that number is. Because again, we don't know. At what number does everybody get androgenic side effects? We don't have that.
It's different for everybody. It's
different for everybody, because that's the other thing about these blunt tools we're using, labs included, is like, how many testosterone receptors do you have? How many testosterone receptors do you have in your hair? How sticky is the testosterone into your testosterone receptors? How saturated? Like, we don't have any of that data.
This is interesting. So when I was listening, it was like, I was definitely binging a lot of your content because I wanted to hear how you thought about things. And I then, in my ADHD brain, I texted all of my fit friends that are on HRT, all of them. And I said, show me your labs. Like, what is your, because they're all doing replace hormone therapy. And I said, what are your labs? And I'll just tell you from my own Spidey research, all of my friends that are like feeling their best and like still they're lean, they're strong, they're like all the things, all of their testosterone levels were between 115 and 200. That was in my own little data. And then any of my friends that were like more declining and not feeling amazing, they were under 50. So I'll say that's that's Natalie's research on it with just her own friends.
And I think, you know, and this is expert opinion. This is not papers, but I see this is certainly true with estrogen. There is a big freaking difference between an estrogen of 0 and an estrogen of 10.
Wow.
Right. And so there's probably not that big and that's like bone, like when you have no hormones, it's way worse than even just having a little bit of hormones.
Totally.
And we have that for bone data for estrogen.
So for me, estrogen like completely stopped my hot flashes because that I had to fix. So I do a patch for that, and I love that. But I don't push. Like I know there's a lot of people that will talk about going higher on estrogen, and I listen to all of that. For me, that doesn't feel well on me. When I go higher, if I go higher on a patch, I get bloated. It's like I just don't feel good. So for me personally, this is not me giving anyone advice. I like a low enough patch where it takes me out of the symptoms and I feel good. And then I like testosterone and progesterone. I like doing that as the combination for me.
Yeah, I think it's beautiful. And I think you are explaining well to people because people want, this is early science. It's nuanced. We're all individuals and people just want to be like, okay, so should my lab be 50? And what exactly dose do you use? Like they're chasing other people's dreams.
Totally. That's like chasing someone else's weight. It doesn't matter. Like, is it muscle? Is it fat?
Yeah. How much do you weigh? Because that's what's best for me.
I hate that question. I'm like, my weight has nothing to do with them.
Exactly.
Yeah. So I'm always hesitant when people ask about doses because it's based on you. And if I'm hearing you correctly, it's based on your labs. You have to have a starting point, but most importantly, how you feel. And my recommendation for anyone listening is the more information like this you can get, whether it's this interview or you just have to do your own research and understand. So I love learning different theories, different people's opinions on it, just so I can take in what feels right for me. And then I test on myself and I go with how I feel versus the lab. So even with the estrogen, like I kept hearing, I need more and more and more and more, but I wasn't feeling good on that. So you have to balance. That's my advice as a friend to those of you listening.
Yeah, I agree. And I don't always think, I mean, it's this weird thing of like more is better. Right. And it's like, I don't know, is that because that's what we think about money? Like, where is this more
in
is
case
better?
Of money,
like,
it could be.
I mean, that's what I'm like, fair enough. But like, are we like, I need more insulin.
Totally.
I need more thyroid.
Totally.
I need more. Like, we don't do that with other
right.
meds, right. And so it's like, why is hormones like, why is the more the better?
Yeah. But some people, some people, they do thrive on higher estrogen or whatever. And so I'm not.
Exactly. But more is better for everybody that's not true.
You know, I just did an interesting test. I don't even know how you feel about this, but I am obsessive tester on things. I just like to learn and do things. And I'm the guinea pig and I love learning. And I just did a DNA test, like just to understand my DNA. And when I got the interpretation of it, I was like, wow, this is wild. Everything I was feeling, it's said in my DNA about like how I metabolize estrogen versus testosterone. Do you have any experience with the DNA testing and what do you think of that?
So I mean, I'm looking at multiple companies because again, I want to be as a thought leader, I want to be on the forefront, but at the same time, I'm very careful that I'm not going to.
Sure.
I don't want to do anything that I'm going to be like, yeah, no. Right. So like I'm cautious, but interested. Yeah. I think it's starting. I think it's in its infancy. I correlated a lot, and no offense to any of the human DNA companies really, but like, you know, when you get your dog DNA tested and it's like half wolf and you're looking at like a and you're like looking at like a 12-pound chihuahua.
You're that's funny.
The science is gonna keep getting better. But
you know what I felt like it was?
I'm not gonna believe this is a wolf.
It felt like if I was going to a psychic. Like that's what it felt like to me. Because it was like, you know, if you go to like a psychic and they're telling you all, and you're like, wow, how'd you know that? That's how it felt with the DNA thing. I was like, wow, how'd you know that? Like describe my ADD, like all the things. So I found it intriguing. But I also, like you just said, I'm cautious of like any one thing. It's like piecing it together, and we're all so unique. And then our environment affects all of that too. So I don't ever believe there's just one thing. Like I like being a detective and learning all that.
I'm pretty public at this point too, right? And so it's like my job is to be cautious and a little bit cynical and to be like, I love that we're figuring this out, but nothing is fixed at this point. Like we are just starting to figure this out.
Totally. I want to back up on hormones a minute and talk about where this kind of some of this previous stuff that has gotten in our heads about hormones, starting with birth control pills, synthetic birth control pills. I was on them for 20 years, starting when I was 15 years old to regulate my period. I wish I was not ever on those, but I was. And many in my generation were. What are your feelings on those? And why do so many doctors tell perimenopause, menopausal women to start them for symptoms?
Yeah, good question. So birth control is world-changing medication. Right? If it wasn't designed to be a birth control pill, that medication would have never been on the market because we'd be like, oh my God, it causes infertility.
Okay. Wow.
Like, what a horrible side effect. Except for that's the side effect we are choosing.
Yes.
Right. Just to say, like, it's wonderful, but it does significant things to your body because like that's what it's designed to do. It's designed to block hormones. Right. So there's a lot that's downplayed because the medications came out at a time where we weren't really asking you about your testosterone levels, your mood, your depression, your sex drive. Right. We weren't like thinking those were important. We were like, hey, we need to help some people not continue to have, they need to space out their families. That's what they want to do. We like, it came from a very good place. People weren't like, let's design something to ruin people's brains and sex drives.
It came from there, but it also was given to teenagers to regulate their period.
Well, that's an off-label use, except for some of them it's on-label. But yeah, because it works to do that.
Yes.
Right? It mellows out your hormones.
Well, for me, it was, I just didn't want to tell my mom I was having sex, so it's like, oh, my period's not regular. I mean, that's the kind of teenager I was. That's not good. but
I mean, I think the internet is currently, it's gotten a little bit more quiet, but they currently was like really hating on birth control pills. And I'm like, you guys don't realize like how amazing this medication is.
Interesting.
Made you not be a teenage mom.
That's true. That part's true. But what is it? What are your feelings on that long term? And I'm interested in your personal and also like clinical, just like what's your feelings about that? And do you think perimenopausal or menopausal women should be on them?
Yeah. So these medications are incredibly safe. They're safer now than they've ever been because they keep lowering the dose to be like, how can we still make it effective and have lower and lower doses?
Okay.
Right? So it's incredibly safe medication, not without risks.
Right.
Keep in mind, everything has risks. Hormones have risks. Not taking hormones has risks. Not trying to prevent a pregnancy when you have sex has risks, right? So I think, again, my pet peeve of the week is like people on the internet being like, is it safe?
Got it. Okay.
And you're like, what does that mean? Right?
So,
like,
yeah.
Driving your car is not safe, but let's be honest.
I don't say it on the internet, but I definitely, well, I am now, I guess, right now. But I have my own feelings about like, and I'm not a doctor, so I'm just saying this as Natalie, as me.
Yeah.
I have my own feelings about being on synthetic hormones versus bioidentical. So to me, I feel that midlife women that are already menopause, perimenopause, like how do they actually even really know what's going on if they're still on synthetic birth controls?
Well, here's what
or is that just my little made up thing?
That's a good question. So here's what I do. You come into my office, let's say you're 44, you're having some hot flashes, moodiness, low energy, whatever. You're still having periods though.
Right.
And so I'm like, okay, do you need a sperm protection plan? And they always look at me super funny because they don't know what it means. And what it means is, do you have sperm in your life?
Yes. Yeah.
Right? Do we have to protect you from the sperm? Which I think is a wonderful way of thinking about it. And so, nope, I've got a vasectomy or I'm same sex or I'm whatever, single. Okay, so we don't have to worry about sperm because remember, birth control protects you from pregnancy from sperm.
Yes.
Hormone therapy does not.
Right.
Right.
So that's your first thing. You're like, this is what it's made for. So let's look at this first. Got it.
Yeah.
So
You're like,
don't need sperm protection. If they don't need sperm protection.
Don't need sperm protection, then how are your periods? 20% of women in perimenopause will have very heavy, irregular periods.
Yes, I did big time when I was in peri.
And the hormone therapy doesn't tend to help that as much as a birth control can really kind of calm that down. And so that's another big reason to consider birth control pills in perimenopause. Makes sense. So you're going to get two schools of thoughts. You're going to get the people who love birth control pills. Everybody should just be on birth control pills until age 53 and then switch. There's that school. And then there's the like birth control or synthetic and they don't even help menopause, perimenopause symptoms that well. So let's give people this. Again, I think it's nuanced.
Yeah. And I definitely think that, but I'm also not an MD and I'm not you. So that is maybe it's wrong, but that is what I've thought and believed.
That it's nuanced?
Yeah, well, that it's
Yeah.
like that it's synthetic and it's not ideal. And because I know we just talked about the word natural. I'm certainly not a natural girl. But like, believe me, I've had my share of cosmetic surgery and whatever. I wouldn't put myself as a natural girl, but I will say for my food and so, like things like that, I'm very, very aware. So for me, my opinion about, again, it's just my opinion. I was on birth control for 20 years and I felt when I stopped it, I actually was more I was attracted to a different type of person after that, like a different type of male.
Data
I
supports that. That's well-published data.
My sex drive went up, not being on birth control pills. For me, I felt like it wasn't letting me be my true self being on synthetic hormones. That's the best way I can describe it. So that's where my opinion came from.
Not to argue you, but just to keep going with that point, a female not getting pregnant is not her true self. I'm not saying women should get pregnant.
Right.
I'm just saying the whole point of that medication is to make you not do something your body would do.
Right. So if I'm hearing you correct, it's great for that. If you do not want to get pregnant, it's safe and protective for not getting pregnant. Yes. But it is going to alter your true self, just like a lot of other things can be. Just like
well said.
Okay, got it.
Yeah,
okay,
to me, I'm like, it's not bad. It's not a devil.
That's great.
It's just like understand what it's there for.
Makes sense.
See if you need it or not.
Well, and I could say probably the same thing about. Look, sorry, I could say the same thing about antibiotics, right? Like antibiotics, when we need them, you need them. You have an infection, but it also doesn't hurt your gut. It could. So we don't just take them to take them. So exactly I guess it's the same kind of thing. Like it's important for what it's important for.
Yeah. Okay. Yeah, I've caught a couple of women, like they come to me for perimenopausal symptoms. I'm like, why are you on birth control? And they're like, I don't know. I just kept being on it.
Right. So that's
where it's like, okay, let's take you off of that and then see how you feel and then keep going. Right. I mean, truthfully, like a lot of the sex med experts, they're like, birth control should probably come with testosterone.
Yeah.
If you truly cared about a woman's sex drive, sexual desire, because it really does lower your testosterone.
So this brings me to
we haven't cared about that, right? Like
we haven't.
We have to start caring about women's lived experiences.
This brings me to another really maybe a strange question, but it's important because I've had a lot of different types of doctors on here. I've had MDs, I've had functional medicine doctors, I've had naturopaths, and it's very different opinions across the board there. And it's confusing for women like me sometimes, like to know who do you learn from. Help us with that too, because you're an MD, but you also are a little bit more, how do I say this? You're a little more out of the box than a lot of MDs. Like I think you've expanded that. You're not just like, I only teach what I learned in medical school. Like you've really expanded that. So what are your feelings on like functional medicine or naturopath or what are you comfortable sharing there to help us understand who to see?
Yeah, I mean, I wish it was easy. It's not easy to like, there is not one credential that's going to give you what you need absolutely every single time. Like these are humans. Trying their best to care for you in the way that they know best how to. And there's pros and cons of each. Now, I think the term functional, to my knowledge, does not have, like, I could call myself a functional urologist. Okay. You can put natural on a candy bar. Like it's kind of a word that kind of means something of like, hey, I kind of care about you holistically and I'm going to think about all these different pieces, maybe have a more in-depth conversation. Okay. But it doesn't like mean that the other ones aren't good.
It's not like a new credential. It's just a name that we're using to describe. Is that what I'm saying?
I don't think like lots of people call themselves functional doctors
And then what is a naturopath? Do they go to, is it the same, is it medical school? Like what is that?
No, it's not medical school. It's a naturopath school. So 4 years of college and then 4 years of naturopath school. I believe there's 2 in the country. Best Year is a big one in Washington State. And then they're a doctor of naturopathic medicine. They do not do a residency like your traditional MD and DOs do. Some are fantastic at hormones. Some are better than your tradition. I'll call us traditional, but MDs. Some are better, some aren't. And so it's not, again, I wish it was easy, but it's a lot of it's
not a black and white answer is what I'm hearing.
It's not a black and white answer. There's great bedside manner and lots of people and bad bedside manner and lots of people, and the credential doesn't help. You want somebody, if I was to rail on anything, it's the insurance-based medical system now.
Oh, yes. I hate when insurance dictates treatment for us. It's just really, it's a mess.
Yeah. I mean, Medicare, for example, and many insurances have vaginal estrogen as tier 3. Like this is a generic.
What does that mean?
It means they're not going to cover it. basically. Like they'll say they cover it, but it's tier 3, which means it's very expensive. So this is a generic $14 tube of vaginal estrogen that decreases UTIs by 50%. It's been around for decades. The most expensive thing about the whole darn thing is the tube that the medication comes in, and insurance companies don't cover it. So
I have a lot of feelings about insurance. I think I started my very first job after college, or like my main job after college, was a medical sales rep. So I was a medical device rep, and I learned really quickly about insurance and how it was dictating treatment. And I saw a very big difference with doctors, and I felt bad actually, because a lot of doctors that were very insurance based, they were like held to this rigorous schedule of I can only see a patient for 5 minutes or whatever it is. They're cramming them in, and they would look for just, how do I just treat this symptom? They didn't have time to go deeper. And then it was always based on what's insurance, how are they dictating treatment? So I had a very bad taste about insurance from that. And I know you probably can't say this, but I'm going to say it right here. I actually got out of the insurance system. I don't even have medical insurance anymore. We went with a health share, which I'm a huge fan of, because for those of you listening that you want to know more about that, health shares are outside of medical insurance. It basically says you're responsible for your own medical. Like you can go to any doctor you want, any treatment you want, you pay for it. But then what they do with these health shares is you pay a little bit a month into this pool. And if you have an incident or injury that is like over a certain amount that you agree on with your health share, then it kicks in and helps you. So it just basically puts responsibility and choice back on you. So I know it's a different tangent, but I feel very strong that having medical insurance always dictate our treatment is not the best way for us.
Yeah. Here's maybe a pro tip if people can do it. Because I think everybody, stop wasting your money on freaking urine tests and pellets. Go get an expert, get on some medications that are reasonable, and then go back into the insurance-based system, have your insurance pay for it, and have your primary care be like, fine, you're happy on this, I'll just do the refills.
But find your doctor first, not from your insurance. Like find who you—
Right. Find the true hormone and sex med experts. Many are still in the insurance company.
Okay.
Don't get me wrong.
Yeah.
But do I think I can get the perfect plan for you in one 15-minute visit? Absolutely not. Especially in perimenopause, right? Where it's like the hormones are ever changing. And so to me, I'm like, go to somebody who where you understand why.
Totally. It makes me sad. I also have personal stories. My dad died because of insurance. Like he went with shortness of breath and pain and all that, and they didn't even check his heart, and he died the next day. So I'm anti-medical insurance in such a massive way, because it's my own personal. Everyone has their own experience.
Yeah.
But
I've been in it for 12 years. Traditional, and I quit December 31st, and now I'm opening up, cash based where I can spend hours with people.
It's amazing.
Because I'm like, what do women want more of? They want to be heard. They want to be listened to. They want to be believed.
Yes.
I can't do that in 10 minutes.
Yeah.
So we need to.
It's amazing. I love that. I love that for you. And people can still submit on their own to insurance if they want to go through that. It's just going to be different. Yeah. Okay. I have more questions about, sorry. I could talk to you. I could see why you were on some of my friends' podcasts like 5 times. There's a lot of questions, and I'm not going to take your whole day, but I do have a few more really important ones. When it comes to, and I've asked this before of other people, but I want to hear it again. And this is so important. Why did HRT get such a bad rap from the Women's Health Initiative back in 2002 or whatever it was? Can you run us down on that? And who actually should not be on hormones? Is it true if you've had cancer, you shouldn't be on them? Help us with that.
Good question. You're going to help so many people with this question. So Women's Health Initiative, $1 billion NIH study asking the question, if we put older women on synthetic hormones, will we decrease their risk of heart disease? That was the question.
Okay.
Whenever you take a medical study and you want to see if it is, useful, does it apply to you?
Right.
Does that question, taking a 68-year-old, starting her on a synthetic hormone to see if it prevents her heart disease, does that apply to the average 51-year-old with natural hormones who's suffering from hot flashes? Doesn't even apply.
Absolutely not.
So that's the very first thing of like, oh, they were asking a question that doesn't even apply to women like me. Noted. So what they did was they went to the media before they published the paper. They went to the media and said hormones cause breast cancer. Notably, estrogen was the one that got noted as causing breast cancer. Some of the researchers said, do not do this. If you let the genie out of the bottle, you will not put the genie ever back in the bottle. They did it anyways because they really wanted to shake up the world.
Yeah.
And they did. They did one of the most damaging things that healthcare has done in decades. And when the paper was published, it was not statistically significant that there was breast cancer recurrence. The placebo arm was flawed. The study was not designed nor screened or randomized for breast cancer risk, right? And so estrogen alone, two groups of people with uteruses and not uteruses. So estrogen alone, if you didn't have a uterus, decreased your risk of breast cancer by 20%. Where was that in the news?
Right. No, it wasn't there.
Estrogen's breast protective. And then if you are on estrogen plus progestin, so synthetic progesterone, which is hardly used anymore, it increased the risk by like 6 out of 10,000.
That was progestins, correct?
Progestin, medroxyprogesterone acetate. So minimal increase if you believed that versus the placebo arm was flawed in the first place. And when you made the placebo arm better, there was no increase in breast cancer. So either way you want to shuffle that data, there is no significant risk. And even if there was with the synthetic, we don't use synthetics anymore anyways. So it's crazy to me that our hormones protect us from breast cancer, and people are afraid of them for the opposite reason.
Now, what about people that actually had breast cancer though? And I don't mean active breast cancer right now, but they had it. Yes, treated, done. The
most, I would say, neglected, suffering group of, the most is dramatic. Very suffering, neglected group of people. So 2 things to know. I mentioned quickly vaginal estrogen. So vaginal estrogen is just skin care for down there.
Okay.
It doesn't go into your
bloodstream. Put that on my face, by the way. I literally use vaginal estrogen.
Look at my skin. It's so good.
Yeah, it's
best. It's the best. So, because it's skincare, and our skin loves estrogen because it makes collagen.
Yes.
So anyways, super low dose, super safe, never been implicated in anything bad. And breast cancer survivors are hardly even allowed to use that.
I know, they get shamed for asking. It's terrible.
They get shamed for asking. You know the divorce rate amongst breast cancer survivors?
It's really sad.
Nobody talks about it. It just destroys relationships.
I will stay on the patch for the rest of my life, even if I have to get it from the black market. Even if I would rather, I know how I feel not being on it. I don't want 10 hot flashes an hour. For me,
it's awful. We need to start caring about women's quality of life. So to answer the other question, so vaginal estrogen in any breast cancer survivor, multiple studies, incredibly safe. It's a very, very rare that you couldn't be on it.
Okay.
And more oncologists are caring and allowing vaginal estrogen.
Great.
So that's our first thing. The second thing is systemic hormones, right? So what's the number one? If you've been cured from breast cancer, what's the number one thing you're going to die of? What's the most common thing you're going to die of once you're cured from
breast cancer? I don't know. Heart
disease.
Okay.
Heart disease. Same thing. The number one killer of all women, heart disease. So women are saying, "Hey, I've been cured from breast cancer. I'd like to protect my heart. I want a better brain. I want to protect my bones. I'd like to protect all these things." And they're being told no. Now, there's a great book. If people are too long, didn't read the book Estrogen Matters by Avram Blooming. It goes into all of the data on breast cancer survivors and hormones. I know multiple people who are breast cancer survivors and on hormones. The tide is turning, especially the receptor negative cancers.
Okay.
They have no increased risk than the general population for being on hormones. That data is very solid. The big myth, and this is worth clearing up on your podcast, that if a cancer is called estrogen positive or progesterone positive, that means a hormone caused it. That's not what it means. It just means that the cancer has receptors for those hormones, just like most cancers have receptors for things. Interestingly enough, prostate has testosterone receptors, and we don't call it testosterone positive prostate cancer.
Wow. So that is wild, because that is what we keep hearing. And then that's
So hormones are food. Food doesn't cause cancer. But if you have cancer, you don't want to feed it.
Right. Makes sense.
You got to take away the food, because the people will be like,
you got to first get rid of, you got to first deal with that.
Get rid of the food.
Yes.
But now you killed the cancer.
So now you can address.
Can you put food back on the table?
Yes.
One would hope.
Makes total sense.
And we have a lot of studies that support that. I would say it's still in mainstream medicine. Medicine, we have 2 decades of doctors that didn't learn how to prescribe hormones.
Totally.
After WHI.
I don't blame them. They're doing what they think is the best practice. It's
in America, where you don't want to get sued for, looking at somebody the wrong way. They're going to be conservative. I don't blame them. So stop suing doctors for stupid shit.
And then we don't have this problem.
So that they can want to help you, even though it's not written out explicitly, right?
Totally.
So it's still an informed consent discussion, risks and benefits. And here's what I know. There's multiple, I don't want to pigeonhole, but breast cancer survivors as everybody, we're freaked out about this tumor. Like, this
Yeah.
tumor is evil. It's awful. It does stupid shit. It comes back in 9 years. It comes back in 17. It does stupid shit. And we don't have any good evidence that hormones will increase the risk of recurrence. But there will be recurrences. That's
Yes.
what happens in cancer.
So people link it to that, but that's not necessarily, we don't
You
know.
have to get over that cognitive correlation equals causation.
Wow.
And like, for the true woman who's like, I've read the data, I've read the books, I've read the studies, I understand this could come back, but my God, I want these hormones for my quality of life. That's who's going to get hormones.
I feel like that was Suzanne Summers, honestly. Like, I mean, I don't know her, I didn't know her personally, but like that's kind of what because she was on HRT after her cancer. And then people said, well, that's what brought it back, but there's no way to know that.
There's no way to know. There's no way to know, but that's what taints hormones for everybody.
Yeah.
Is the brain's passionate interest in trying to link things that are unrelated. Right. But if a woman has been treated for breast cancer and she's expecting her doctor to say, hey, why don't you go on hormones?
They're not going to.
That's not going to happen.
No, you have to do your own.
If you want it, you have to be the person requesting trial of treatment.
Makes sense. One more question, because I brought this up at the beginning and I want to make sure I don't skip over this. I know that testosterone is really linked to also helping prevent bone loss. Is that because we're maintaining muscle and able to easier grow muscle, so we're preventing it? Or is there a different thing I'm not aware of that's helping with bone loss there?
Oh, it works in bone by itself as well.
Specifically to bone. So it has nothing to do with the muscle.
I mean, it helps muscles. Yeah. So what is it? Everybody hates, like, everybody's so afraid of the word anabolic, right? Like anabolic steroid.
I think it's
steroid.
steroid.
Testosterone's an anabolic steroid. Like, that's meaningless words. Anabolic just means to build, right? So it helps build up the body, helps maintain your muscles, helps maintain your bones. Steroid just means a certain way the carbons are arranged in a ring. That's all it means. Vitamin D is a steroid, right? So
I didn't know that.
It's a hormone. As a steroid, it's definitely a hormone.
Okay.
But so, like, people are so afraid of what these words are, but it's like, no, it just means it helps maintain, it helps build, right? Builds your bones, builds your muscles. That's what anabolic means. Catabolic means to tear down.
Yeah.
So, but like they've got reputation management problems, basically.
Yeah.
We've got plenty of data in bones in men, screaming data in bones in men, in testosterone.
So to wrap
we do have some studies looking at estrogen versus estrogen and testosterone and bone health. Not as many studies as we want, but we have studies saying that both of them together seem to help bones more, which makes sense because in your body, premenopausal, you have 4 times the amount of testosterone than estrogen.
There's one hormone we didn't touch on at all, and I just want to like briefly make sure we're mentioning it: progesterone. Do you make sure if someone's on estrogen that they're also taking progesterone, and why is that important?
So if they have a uterus, they must, because we don't want unopposed estrogen. Right.
Okay.
Your body had all of these hormones before menopause. Right. So your body actually, like, your uterus doesn't do well when it just has one of them. It needs both. So if you have a uterus, the rule is you must be on a progestin, whatever it might be, an progestin secreting IUD. Right? Okay. So for the perimenopause.
It's like the balance of it. It's like not just training your bicep, you do your tricep too. You need the balance.
Exactly. Yeah. Yeah. You don't want to be unilateral on this. So that's how, and because of the WHI, they were like, yeah, but you only be on it if you need it.
Mm-hmm.
But micronized progesterone, that's the body identical, so normal, so safe, probably breast protective, certainly not breast harming, like incredibly cheap,
safe, and amazing sleep.
Really amazing sleep. So many people think it helps moods and anxiety.
It does. I mean, it's great.
Yeah. So
I feel like hormone replacement has been, I mean, I love some supplements and eating and working out and doing all the things, but there is nothing that has helped so much with menopause than HRT. Like, I'm like, I can't believe.
Thank you.
It's so sad to me that so many people don't know or can't get access to it, or it's like, it's really,
it's bad out there.
Yeah. This is a big thing.
Truthfully, it's going to be, we're going to see health, give it this 10 years, because who's getting hormones right now? The educated people with resources.
Yeah. It's sad.
Educated resource access, right? Yeah. So put those people on hormones. These people didn't get hormones. Check on them in 10 years.
Yeah, it's not fair. And then
huge health disparities.
We need to get that fixed 1,000%. But I also love what you said about the natural thing, because when people are like, well, I just did it all natural and whatever, like that. Okay, great. Let's talk in 10 years. Let's talk in 20 years. Let's see.
I love picking apart natural. I'm like, shoes aren't natural. Your car's not natural. Air conditioning's not natural.
We all got braces. We all had braces.
You have braces. Like you're just picking your natural to like should on somebody else. I wanted to go into for the breast cancer one more time. Testosterone has never been shown to increase risk of breast cancer. If anything, there's studies that show testosterone decreases the incidence of breast cancer.
That's amazing.
So again, we need more studies, but the studies we have say that should. So when we say hormones post breast cancer, we're really kind of talking about estrogen still being the boogeyman, even though it's not the boogeyman. Testosterone is the core operator.
Love talking to you because I feel like you just completely bridged the gap for me, because I feel like I hear like these extreme ideas, and then I hear like ultra conservative. And so I feel like you're a really nice bridge in the, like in the middle. Like,
I'm nobody's friend.
No, but I thought it's perfect. Actually, I like that, because I feel like we need to hear all the information and then decide what's best for us. And what I'm hearing from you is you're not saying like you, even when we talk about Dutch tests, you didn't say don't do it. You just said this is what the research is not showing on it yet. If you want to do it, go for it. It's just not. So I don't think that was like you're not bad mouthing it.
I'm not slamming it. Yeah. And same with different types of practitioners and providers of like, there's great ones and there's shitty ones, just like car mechanics and like artists, you know?
Well, so and I also love what you said about birth control, because like, look, I'm not a fan of it personally. I don't like that it's the synthetic hormone also, but you brought up a very valid point, which made me think of it like antibiotics now. Like does its job and it's safe for that. But like, if you don't have that needing it for that, like, do we need to be on it? So that was very practical, because that's the way I literally look at antibiotics. People villainize antibiotics, but I'm like, but they can save your life sometimes. So I don't know.
It's going to wreck your gut, but it'll save your life.
Yeah. So you pick and choose, like, what is right now, what's most important? Like if you're dying of some horrible infection, you might need the antibiotics and to fix your gut after. Like, it's just a thing.
Totally. Yeah. So I think the more you know, like, to me, the amount I know at this point makes me sound very like nuanced and great. Like, I'm not all about like the newest, hottest, best thing, because I know it'll come and go.
Yeah.
Right. And so to me, I'm like, I want what's practical, sustainable for 40 years post menopause, knowing that, you know, things are going to change and we might change dosing and we might blah, blah, blah.
And I like that you're open-minded too. Like, just like you're seeing the trend with DNA testing, you're like, well, I'll look at it. I'll see. So it's not, you're not saying no to things. You're just being more practical and open-minded. Where can people work with you? Like, do they have to be in Washington State? Yes. Like, how do they,
so I only have a Washington State license. This is state licenses. Not people don't know that. They're like, my doctor, blah, blah. It's like, states want doctors' money and they make us all pay for state licenses.
Okay, got it.
Just for people who understand, like, people are like, my doctor, blah, blah, blah. It's like, dude, do you think practicing medicine in Wisconsin is any different than practicing medicine in Michigan?
Yeah.
Right? Like, these are antiquated, bureaucratic walls that they've put up. So, but I get to just be practicing in Washington State because this is where I live, and Lord knows there's enough people here. So yes, you have to come to Washington State to see me.
Okay, got it. And then where's is Instagram your main social media place?
I love Instagram. I just canceled TikTok again in the whole like what's happening thing, and I'm like, oh God, am I gonna reload it up again, like for a third time?
I heard once you delete it, you can't get it back. So hopefully that's not true. It's like not in the App Store now.
I haven't tried.
I'm so confused.
It's not in the App Store now.
Well, it's very confusing what's happening there. But I mean,
I feel like I just need to pick a team. And I really love the community of Instagram. I love the Instagram community that I've created. Yeah. Like, I just love it. My podcast is called You Are Not Broken. That's the same as my book. And then
that title sums up you, I feel. You are not broken. Like, just here's the stuff.
Totally. And dude, people will argue for their brokenness. That's the other weird thing.
They do.
People will be like, but I am. And I'm like, okay.
If they believe they are, then they will say that way.
Yeah, I know. It's fascinating. And then KellyCaspersonMD.com.
Well, this was awesome. Thank you so much. Thank you
Thanks
for
having
me.